Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish and coming to you with another installment of Caregiver Coffee. And we're going to continue our conversation about medication. So we've been talking about the 4 M's, what matters, medication, and we will also be talking in the future about mentation and mobility. But we're still on the M for medication. And today we're going to be talking about polypharmacy and what that means, and what that means to you, and some things that you can do to protect yourself and to look into your unique situation. Before we get into that, just a little bit about the caregiver support group that we have. Every Tuesday of the year, basically, except for when there's Fat Tuesday, we don't meet then, but then we move it to later in the week. So we meet 4 to 5 times a month on Tuesday evenings from 6 p.m. Central to 7:30 Central. The first Tuesday of the month, we're in Slidell at the Activity Center. The second Tuesday, we're online using Zoom. On the third Tuesday of the month, we're at the Coast Senior Activity Center. And then the fourth, and sometimes the fifth Tuesday of the month, we're back on Zoom. So we hope that you can join us in any of those locations or venues or online. If you can't, if Tuesdays are not good for you, let me know. I'll help you find a support group in the area because there are a few, and especially there are some online as well. All right, so this topic of polypharmacy, I'm going to define it, and I'm going to be using an article from the National Institutes on Health. I will link to this in the description because I do encourage you, as always, to look at the article that I'm highlighting because I won't get to everything in it. And that way you can also print it out and make notes on it. You can also share it with others, which I hope you do, because this really is like all the topics, they're all important. They affect our health and our ability to age in place for as long as it makes sense. So this article is a research highlight. It says it's called "The Dangers of Polypharmacy and the Case for Deprescribing in Older Adults." So as we get older, as you would imagine, we develop more chronic conditions, which means that we typically have more medications, both prescription and over the counter, to help us alleviate those chronic conditions. And there's an issue with that. The more drugs that we have, the more likely there can be some side effects, and I'll talk a little bit about that. So inappropriate polypharmacy. Now, polypharmacy technically is defined as having 5 or more medications. But it goes a little further than that. It's not just the number, but that's when they find that we can call it that and start really examining it. So inappropriate polypharmacy, the excessive or unnecessary medications, increases the risk of adverse drug effects, including falls and cognitive impairment, harmful drug interactions, and drug-disease interactions, in which medication prescribed to treat one condition worsens another or causes another one. And patients may be prescribed medicines that are unlikely to help, potentially harm, or they're misaligned with the person's or the patient's health goals. It's also a tremendous burden for patients and their families who need to understand the purpose of the many prescriptions written by multiple providers to get refills, to take each medication at the correct time of the day, and to recognize side effects. There's a lot that comes with even one medication. So when you multiply that, it becomes a burden. And so that brings in the scientists in this uncharted territory. It says in the field of deprescribing, a vast majority of healthcare spending goes towards treating people with MCC. That's with where do they define MCC? I think that's just having multiple medications. And scientists are working to advance the field of deprescribing. There's an actual field of this. Here's a quote from a principal investigator. Deprescribing is an exciting and challenging field. There isn't a one-size-fits-all approach, and we must consider the potential risks and side effects, costs, and burden on the patient and the caregiver, and to balance these for the intended effect. Let's see, I want to get to Prescribing medications is often seen by clinicians as doing something for the patient, while stopping medications is often seen as giving up. That's a quote from Dr. Green at Johns Hopkins. And his particular research focuses on identifying how clinicians can best communicate with older adults and their care partners to increase the acceptance of deprescribing. So that's really interesting because um, let's say the doctor does offer the idea of deprescribing, or a better term is really optimizing the medications. There are some patients that might meet that with some reluctance and may not be comfortable with that and may not be trustful of that. And some doctors aren't going to bring it up. So, that's when it comes to patients and care partners advocating for that. And I would say, so just, I'm not reading on the article, this is just a comment. So deprescribing is a methodical way of optimizing the medications. It's typically not done, when it's done right, it's not done in a haphazard way. It's done very carefully. It's done in conjunction with the patient. And it's done to look at the side effects and everything. And as we age, medication, our body processes medications differently. So medications we might take in our younger years may cause conditions that we don't want, maybe like a brain fog, maybe falls. We mentioned that before. So it's important to really take a look at this and to consider it if your physician approaches you with concerns about polypharmacy. Memory problems, while common, are not the only symptoms of dementia. Behavioral and psychological symptoms such as delusions, apathy, and agitation are common for all stages of dementia, and they can cause significant distress. And this is all under the heading of examining pharmacy risks in people living with dementia. And as a result, people with Alzheimer's and other forms often receive psychotropic or opioid medications such as sedatives, tranquilizers, and hypnotics for these and other symptoms, such as depression, anxiety, and sleep problems. But a combination of 3 or more of these drugs can be very dangerous and should be used with caution with people who are living with Alzheimer's disease. Let's see. In order to prescribe drugs safely to older adults, medical professionals typically use the American Geriatric Society's Beers criteria, BEERS, and this is to look at potentially inappropriate medication use in older adults. This Beers list lists a prescription medication, the over-the-counter medications that older adults should avoid or use with caution. So they're using this list, but they're also using their clinical judgment, looking at your specific case when they're doing that. Talking with your doctor about deprescribing. If you have a medical condition or disease, your doctor may prescribe a drug, and medicines do help us live longer and healthier, but taking them the wrong way or taking certain drugs together can be dangerous. Also, as you age, I mentioned this already, so we'll go over that again. If you think your medication is not working, you should talk with your doctor. You may want to discuss switching to a new medicine or stop taking the current one, but you want to make sure that you're not doing it on your own. You're doing it with their guidance, because some drugs, as you know, need to be tapered off and cannot be stopped immediately, or else there can be serious health issues with that. So here's some suggestions about talking with your doctor about prescribing. So here's some tips to consider. Together, make a complete and accurate list of which medications you're currently taking. There's even a chart that is hyperlinked in this article where you can do that, where you can you just fill out the table or the grid. Make sure you know the name of every drug and ask the doctor to write down how often, how long you should take it. Discuss any symptoms that if any of the drugs might be causing them. Make notes about special instructions. Understand why a drug is prescribed. Consider potential harms. Can this, for example, can this particular drug that you're on, could it impact your memory? Keep in mind the goals of your care and what matters to you in terms of quality of life. So all this is very important. So So if your doctor is not, if you have 5 or more medications and your doctor has not approached you about potential polypharmacy or side effects, you can do that. You can open that conversation with them, and it can really just be, hey, can you help me understand all these medications? I'm not sure I need to be on all of them. If that's the case, maybe you're fine with that. But it's good because you do want to you definitely want to check this out. You want to consider this if you have some side effects, and sometimes cost, and again the burden of remembering to take XYZ drugs, so many times a day can also be, can be a reason why you might want to consider looking at your drugs and making sure they're optimized. So yeah, it's a much longer article than I highlighted. So there's still some really good content on here that I left for you to read up on, and I hope that you will share this with your family and friends, because polypharmacy is something that can happen to any of us, and it's just there's a lot of research going on, a lot of credibility with this. It's not, like I said, it's not like a haphazard type of thing. So I hope you'll consider that as we examine the second of the 4M's medication. So I think we'll stop right here. Remember, the link to the article will be in the description of the video, and welcome your questions. If you have any, you can certainly reach out to me. If you put something on Facebook or YouTube, I may or may not see it, but you can also contact me if you're able to make it to the support group, and we can discuss things like this. So thank you for your attention, and thank you for your support of the Council on Aging at St. Tammany. And until the next Caregiver Coffee, I hope that you have a great week. Take care.